Steve and Caroline, absolutely fantastic. So thank you. A great fireside chat. A lot better than Graham Norton, I thought. So you should go into business. But as Caroline says, an exciting part of the day. We are now moving on to our 3 annual awards in terms of lightning talks, team of the year, and impact of the year. And I should say that it was hugely competitive, as ever, a very tough field. And can I thank all the chairs and panelists, which includes patients and team members from across sectors and from across the UK and internationally. So what we're going to do is hand over to Fatima, Anne, and James. Fatima is one of our HDR fellows at the University of Swansea. Anne is a very distinguished colleague from the University of Bristol, and James is one of our esteemed board members. But here we go. Let's see who has won. So over to you, Fatima.
Thank you, Andrew. And I would like to add a note here that attendees often cite these lightning talks as their favorite part of the scientific conference agenda, and this year has been no exception. We had a pretty competitive selection process with high quality applications from across the HDR UK community. So I would like to sincerely thank the panel for their invaluable input, especially on the patient and public aspect. Rosanna Fanesi, Chris Monk, Alice Turnbull, Aydin Doherty, Nikki Best, Holly Dawn Murray, and Melissa Lewis Brown. Thank you. And a huge thank you to all those who submitted application, and indeed a very particular congrats to those who presented their talks earlier today. And now it's time to announce the result of the live votes from the audience. So our second runner-up, congratulations to Yelena Besvik for her presentation on the UK Biobank Serology study. And our runner-up, congratulations to James Liley on his presentation on predicting emergency admission in the Scottish population. A mammoth well done to the winner, Daniel Thompson, for his presentation on assessment of the likelihood of test positivity in pupil and staff in relation to other recent cases in linked pupil and staff or their households. So very congratulations, everyone, especially to Dan. Over to Anne.
Thank you very much. I have the absolute pleasure to announce the winner of the Team of the Year, and I worked with an amazing team of 6 on the panel who had the pleasure to look at all the applications, and they were really amazing. So thank you to everyone who submitted applications. We had a very difficult time in working out who should be awarded, but here are the 3 shortlisted winners. And the first team, for all of these, we're very impressed with their supportive and multidisciplinary teamwork, particularly during COVID. So EMAC managed to set up an ICU bed management system over 5 London hospitals during the pandemic to manage beds for COVID patients. NHS DigiTrials had managed to set up a very amazing system for clinicians to manage their clinical trials. And CVD COVID UK, CVD stands for cardiovascular diseases, have managed to set up a system for analysing COVID patients and their cardiovascular diseases, so the interactions between them too, and set up a platform for that. And the winner of these 3 impressive teams is CVD COVID UK. And this team have put, it's an impressive over 170 members, led by a huge team of people. And we're very impressed about the fact that they had worked across 41 organisations across the UK and set up an amazing platform using people with many disciplines and career stages, whether as a team, and that anybody could join up if they agreed to the consortium principles. So fantastic work, CVD COVID UK. And just to say, the prizes are for all 3 teams who were shortlisted, a professional case study written by a science writer, and the winner gets a mentoring session with an HDR UK senior leader and a professional training and development course of their choice. So thank you everyone for participating, and I'm going to hand over to James.
Thank you very much, Anne, and it's my great pleasure to introduce the Impact of the Year Award. Before doing that, I'd like to express my sincere thanks to the very wise judging panel of Rachel Alsop and Yo Yehudi and Dawn Murray for supporting us. And I'd also like to thank everyone who submitted their proposals this year. We really were spoiled for choice. But we had to choose, and the 3 shortlisted candidates for Impact of the Year are the Recovery Trial, for its demonstrated impact of digitally driven data-rich trials to transform the speed and scale of clinical research, which will have a lasting impact on the way treatment trials are conducted in the future. Second, the real-world validation of COVID-19 vaccine effectiveness through rapid use of linked national data programme, for its innovative and hugely collaborative approach, which has helped pave the way for citizens and society to escape the pandemic with demonstrable impact around the world. And third, the Principal Trial, for its innovative use of primary care data and settings while working at pace and scale. And without further ado, I can announce the joint winners of the Impact of the Year Award. These are 2 brilliant programmes which the panel found it impossible to choose between. And they are, first, the Recovery Trial, with its impressively rapid recruitment, broad reach and findings that have helped save numerous lives around the world. And the real-world validation of COVID-19 vaccine effectiveness through rapid use of linked national data programme, for showing commitment to transparency, use of a TRE, patient-public involvement in design and conduct of the study, and use of a proactive media approach to disseminating results. Huge congratulations to both teams. Your prize is a professional case study by a science writer, a mentoring session with an HDR UK senior leader, professional training development course of your choice. We also wanted to recognise 2 projects who have been commended for their reproducibility, one of HDR UK's core values. All applicants to the Impact of the Year Award were asked to highlight any practices employed by the team that supported reuse. And so I'm delighted to announce and congratulate our reproducibility recognition recipients. And they are the Polygenic Score Catalogue, as an exemplar of a high-quality data source designed with the FAIR principles of data in mind and with impeccable metadata. And the Early Warning Scores News 2 to prevent risk of severe COVID-19, an exemplar analysis that has been designed with reuse in mind. Where the original data are missing due to necessary privacy protection measures, the researchers made sure to provide full explanation and alternative synthetic data sets to allow the tool to still be effectively run without compromising patient data. Congratulations to you both and to all the teams being recognised today. Andrew, back to you.
Fatima and James, thank you. That's tremendous. What great projects, worthy winners. Congratulations to them. Commiserations to the losers. But I think you'll agree, absolutely outstanding. We may have to improve the quality of the prizes next year. We might throw in a month's summer holiday in Scotland as well to entice people.